am Caprice Crawford, the HFA Education Manager, and I'd like to welcome you to the Home Furnishings Association's webinar, The Hidden Value of Employee Benefits. Today, we will explore the importance of investing in our employees, and we'll learn how to craft a benefits package that aligns with your business goals and enhances workplace satisfaction. We'll also learn how to communicate the value of benefits to your team. This webinar is recorded and will be available on demand at myhfa.org/webinar. And if you do have any questions, please use the Q&A button at the bottom of the screen, and we'll answer as many as time allows. And lastly, we'd like to thank Synchrony, our education thought leadership sponsor. And let's get down to business and let me introduce our panel of experts. First, we've got David Ainsworth, who is the VP of Enterprise Sales and Portfolio Manager for Decisely in the HFA Healthcare Solution. David is a seasoned health insurance professional specializing in helping small businesses find tailored health insurance solutions at competitive pricing. With experience in building and managing affordable, effective plans, David is dedicated to ensuring businesses and their employees remain physically and financially healthy. Next, we've got Irene Fostick, the Senior VP of People and Operations for Levin Furniture and Mattress. Irene brings a multitude of experience in all facets of human resources and operations leadership. Her current responsibilities include sales, operations, customer service, as well as human resources for Levin Furniture and Mattress, John V. Schultz Furniture, and Ashley Stores operating in Ohio and Southwest Pennsylvania. Next, we've got Sarah Luther, the Director of Talent and Employee Experience for Hometrends. She is the Director of Talent and Employee Experience. Sarah focuses on creating opportunities for employees to reach their greatest potential through motivating work tasks, innovative learning experiences, and building meaningful relationships within the organization. And last, we've got Tracy Jackson. She is the President and CEO of HR Easy Incorporated. Tracy has extensive experience across private, public, and employee-owned companies, specializing in recruiting top talent, optimizing benefits packages, implementing total rewards programs, and ensuring that you remain compliant. Now, Tracy today is going to lead our conversation. Tracy, I turn it over to you.
Thank you all for allowing me to do this session with you today. Some of you may remember my face from a few years ago. I work with HFA on some of these different projects, and I've done lots of webinars. Shannon can't be here today because she's ill, so I'm going to be leading this. But in addition to that, I also have worked for years in the home furnishing industry, so I'm familiar with it. I was the VP of HR with Sleep Train for 12 years. Also, I worked with Mattress Firm as the VP of HR. So I've been in your shoes before. So this is going to be an interesting conversation, and I really love the panelists that we have here. So I'm going to start this discussion by talking about employee benefits. They're often seen as a major cost, but today we're talking about the hidden value of them. And from our experiences, what are some of the misconceptions retail business owners have about offering benefits? I think this is an interesting question because it's going to be unique for each one of you. But if you only look at it as a cost and not necessarily as a way to attract and retain that top talent, that's obviously something that can be, a reason to look at like your exit interview information to see why employees are leaving. But in addition to doing exit interview information, it's also good to find out why people stay. And I think that's a missed opportunity for us to understand the hidden value is to talk to people about why they stay and looking at the people who you really want to attract and say, here are some of the top employees, and let's talk about why they stay. And then you might realize that there are some opportunities or information in your organization or in your benefit package that's really encouraging them to stay. So I think that's one of the biggest reasons or hidden reasons why it's important to have the benefits, but it can't just be looked at as a cost. It really is a way that people are able to, have a job that not just supports them financially, but also supports them as a person, as members of their family, their well-being, and lots of other ways. So I would love to open this up to the panel to see if you also have some thoughts or ideas on that question.
I won't take too long, but I think ultimately it starts from the recruiting process and the attraction of talent. And in your initial conversations with candidates or A players that you're trying to bring in your organization, this is one of the biggest initial conversations that you have with an employee to attract them to your organization. So making sure they understand, of course, it's always in the job descriptions. It's always talked about in every conversation before onboarding somebody, because quite frankly, a lot of people need a position where health insurance is offered or a good PTO policy or plan. So that's my 2 cents.
And if you're like me, Sarah, that's like, and anybody who does recruiting, it's not just the pay. They always want to know about your benefits. And that makes or breaks whether or not you get the top talent that starts in your organization. So I think that was a great point that you made, Sarah. So thanks for bringing that up. Anybody else want to join in on that? Irene, maybe?
Yeah, I agree with Sarah. I mean, we have some very large retailers and businesses in our recruiting area in where we do business that if we weren't competitive with that, we wouldn't even be at the table to recruit top talent. So I think it's very important. We've added programs through the years where, we've added different benefits. We have an aging population, so we've added for those who are retiring, Medicare counseling, so that when they're making that transition, they can make it with ease. So they're getting plan Bs that they feel comfortable with. We've added mental health benefits, which have become increasingly more important to our population. But having a very good medical, dental, vision, life, short-term, long-term disability, to me, those are ground zero. You have to have those things just to be able to be competitive for talent.
Irene, I think you made a brilliant point, because I think initially what I've heard from some people is when they start business, they're like, well, a lot of our employees, they don't care about the benefits, they want more cash. But as the employees are aging and realizing they can't stay on their families anymore, and they've been with you for a long time, you get more tenured staff, you have to understand that that's going to be a deciding factor whether or not they stay there or not. So you may have to continuously look at the demographics of your organization and make sure that you have the right things to keep the talent that you want to keep. So talking about the aging, Irene, I think was brilliant. So thank you for bringing that up. David, I know you have to meet with business owners and leaders in HR to help to design their plans. What are some of the things that you might share with them about the misconceptions or why they should think that benefits are really important?
Yeah, absolutely. So at Decisely, we're not just a brokerage firm that helps design and find plans and works with carrier partners and the HFA as a partnership to use the buying power to get some discounts, but we also do the statistics. So what we've been able to find, and clearly recruiting is huge on the front end, but it's also a motivator on retention. So typically, employers that offer a comprehensive benefits package have employees that stay employed with them twice as long. And as any business owner knows, it's not just the cost of replacing an employee, but it's the recruiting of someone to replace them, and it's the COBRA potentially. There are additional costs that go with turnover. So it's one thing to get them in the door and have quality A players, like has been mentioned by Sarah and Irene, but it's also trying to keep them employed longer and with you as a team member. And so there's definitely a value to having a comprehensive benefits package that keeps you from having to use additional costs to replace staff.
Thank you for sharing that, David. I think those are great points. Let's talk a little bit more now about how benefits impact your business. So let's talk about how do well-structured benefits impact employee retention, morale, and particularly in retail where turnover is often high. Does anybody want to jump out and talk about that one?
I can start.
Great, Irene.
We do some things that are unique, I think. So we do offer wellness incentives. We really care about whether or not our employees are getting their annual physical. Are they seeing their doctors? Are they getting the tests that they need to test? And several years ago, we had a situation where one of our employees' spouse had never been to the doctor since she had delivered their son, since she had her son 30 years prior. And unfortunately, when she went to the doctor, she had cancer and it was stage 4, it was terminal, and she passed away. And it was a lesson for me that I went through saying, we can't let this happen anymore. We have to ensure that our employees are getting their annual physical. And so we put in place a wellness incentive, which is a discount off of their benefits for any of our employees and their spouse who is on our plan, that they get their annual physical. If they get their annual physical, they get a very generous discount off of our benefits plan. And I think that that, along with some of the other things that we do, which are benefits fairs, we do webinars on our benefits on a regular basis so employees know what's available to them, because many times they just don't even know all the things that are there. And that really keeps people engaged. And we have 30-year plus employees that work for us. And I've often heard from them that they feel that the company cares about them. And that I think is so important to employees, to work at a place where they feel that they're doing something meaningful, but also that they are cared for.
Thank you, Irene. That was a great story and anecdote for people to really, that they can relate to. So thank you for sharing that. So do either
Yeah.
David or Sarah want to jump in on this one?
I think just a quick comment. I mean, I agree 100% with Irene. I think benefits are really explained and went over with employees in, their first initial onboarding and then maybe once a year. So it's very important too that you continue to educate, just like on their position, educate and training on the benefits that they have and what advantages they have with like a pre-tax deduction with benefits and anything else that you offer that could potentially save you money in taxes even. And we have a lot of different options on our plan. So just the overall education is very important, consistent. And then all of your stakeholders or leaders in your company, I mean, they have to understand and know how to communicate those benefits as well, not just your HR person. So.
And I think what both you and Sarah and Irene said is it's not just for when you're sick. Like, you want them to go get that preventative care so that they can avoid being sick. And the fact that you guys are demonstrating that through the programs that you have, I think are really amazing. So thank you for offering those suggestions. Go ahead, Sarah.
From what I know, most healthcare plans pay 100% of preventative care.
Yes.
So
Exactly.
that's a big thing to make sure that the employees know.
Yeah, the patient, the PPACA, so the ACA, that is required. So there's a schedule that they have. So your annual physicals, they cost nothing for you to go see, even with high deductible plans. And that might be one of the reasons why you might even want to introduce a high deductible plan for those people who say they never go to the doctor. They really only want it for catastrophic reasons. And I remember when I was at Sleep Train offering that. And at first I thought, I don't know who would really be interested in that. But there was like a double benefit in that people actually recovered. They got coverage. They knew that they were only going to go once or twice a year. So it got their costs way down. We were able to contribute a little more to that one than the base plan. So it came to them at not much of a rate. And they got to have an HSA, a health savings account. And what I found is I thought that might only attract the younger population, but I was wrong. It actually also attracts some of the older demographics because they have the ability to save through that health savings account, even for their retirement, since that account is different than your flexible spending account, where that is on an annual basis. Your HSA, you're able to keep, that's your money, and you can use it into retirement, and the money in there can be used for investment. So what I found is I went in with one thought, of this is attractive for my younger population, but I came away from that understanding that it's not. And I had to be careful not to be too narrow-minded about who I was talking to about those different benefits that we have. So a lot of people were very excited about having a high deductible plan. And I know, David, this is your wheelhouse. Do you want to talk a little bit about that?
Yeah, so I wanted to tap on what Irene and Sarah were saying too, in that there's two main problems or costs associated with group healthcare. You know, we'll just talk about the healthcare piece. There's certainly we provide other benefits, dental, vision, and all that, but it's your monthly premium. So it's how much you actually have to pay for whatever plan you've elected, and then it's your cost of care. And sometimes it's that cost of care that prevents people. They may do their annual wellness, but if they're not feeling well, they may not go in and get checked out. And what we've been able to do is we've partnered with certain carriers who want you to do that maintenance. So that lady that didn't go to the doctor for 30 years and unfortunately had that severe diagnosis, the plans that we work on actually want you to go take care of yourself. And those plans, when you go to the doctor or specialist, have a $0 copay associated with it. So what they've decided to do is, instead of normal group insurance where it prices you out of even taking care of yourself, and then when you do take care of yourself, if it's not outside of your annual wellness, there's co-pays and there's co-insurance and deductibles that keep people from doing that maintenance. They've eliminated those costs in some of these plans, and they're also very competitively priced. So, and when I talk to folks about these plans, they're always like, oh, this is too good to be true. I can't believe it. And then I tell them, I'm on the plan. So this is what I use to take care of me and my family too. And it does work. When I go see a specialist, chiropractor, mental health, no copays. Doctor, no copay. Telehealth, no copay. So, I think that it's really coming down to, like, Irene, they care about their people. And I certainly see that through business owners that I deal with on a daily basis. If you want to be able to offer something that is affordable and that they can use to take care of themselves, then we do have solutions for that.
Thank you for sharing that. Let's talk a little bit about innovative perks and strategies. Irene, given your experience that you have in operations and HR, how do you balance offering benefits while managing operation costs?
Well, that's not easy, especially in the current environment. Benefits costs were pretty steep this year, and they're expected to increase. But there are a lot of new things coming down the pike, and I know David probably is going to be the pro to talk about these things. But whether it's an ICHRA, whether it's concierge type programs or a staff model HMO, so there's a variety of options that we are looking at as an employer that are new and innovative that are in the marketplace. Or even if it's being part of a business group on health and your local consortium where, as David said, they're buying in mass. So you're not buying on your own, you're buying through a consortium where you're part of a larger group. So one, you're not getting hit with that high cost claim necessarily. That experience isn't hurting you as much if you're part of this large consortium. And they are all throughout the country. We used to be part of one called the Business Group on Health. They typically work better if you're self-insured, and then they carve out prescription drug benefits. So we're always looking at what's new in our marketplace, attending seminars such as this to hear what's out there, sharing with other employers, and also talking to our associates, which I think is really important. And you mentioned it, Tracy, whether it's in exit interviews or whether it's in your, we do a quarterly survey of our employees, whether you're getting feedback of, gee, I wish I had this instead of that. So we do offer several options. You mentioned a high deductible plan. We have traditional PPO as an option. We have a high deductible plan. We have a performance network, which is a narrow network that's much more affordable for those who are willing to go in one group of providers. So I think it's looking at what's out there and trying to offer a variety because there's not one flavor for everyone.
Thank you. And Irene, you mentioned an ICHRA, and that term might not be familiar to everyone. So that's an individual, what is it called? Individual Coverage Health Reimbursement Account. And David, I don't know if you don't mind maybe speaking a little bit about that for people who maybe are not really familiar with that.
Sure, be happy to. So ICRA's been around since actually 2019. It's a compliant ACA structure where employers can actually do a reimbursement instead of a traditional healthcare contribution for employees that elect to take plans on the marketplace. Now, we've seen that this is truly helpful in for some of the smaller to mid-sized groups, so the groups that are under 50, but it's actually gaining traction in some of those groups that are even larger than that, especially depending upon the population and the plans that are available to your folks in that area. And we have a way to do an entire analysis of which plans are available. We have a link directly through our portal to the Catch system, which actually pulls marketplace plans directly. But here's where it's advantageous. Some folks that have a smaller population and can't afford to offer a standard group plan sometimes will just gross up the employee's salary or give them a stipend to go out and purchase their own individual health care. That stipend or that gross up of salary is taxable to the employee, and the employer is also paying payroll tax on that. With the ICRA, the employee gets a tax-free reimbursement for whatever the set amount that the employer is contributing to that for their individual plan. So it's a tax-free, they don't pay tax on that reimbursement. And the employer gets to write that off as a healthcare contribution and doesn't pay payroll tax on it. So it's definitely it's like I said, it's been around for 6 years, but it's catching on. So I can say it's a new and innovative way to look at group plans that are ACA compliant, but can be advantageous for some of those smaller to mid-sized groups.
Thank you for sharing that. And Irene, are you all offering ICRAs in your organization?
We have looked at it. We are not currently this year, but we are certainly considering that go forward as something just because of the cost of healthcare and still wanting to be able to provide a very good plan for people. So we have looked at it even for carving out certain groups. So certainly a consideration for the future.
Well, that's great. And David, thank you so much for that explanation, because I'm sure there's a lot of younger or smaller organizations that are struggling to figure out how to be innovative in their approach to offer benefits. So thank you for sharing that. Sarah, do you all have any that are similar to these? Innovative perks or strategies?
Yeah, so I guess going outside the health insurance dental vision box, I mean, we do have a package outside of that that really focuses on our vision and our mission and part of what the employee experience is, and the attraction and the retention of our employees. And we track a certain amount of families that we impact and keep that visible in front of our communities and our employees, but making sure that they understand that their role has an impact on what our mission is. And so we do pay we reimburse employees their hourly rate for a certain amount of volunteer hours for every year or every year quarterly. And then we also do some donation matches. So if employees make a donation match towards a foundation that's important to them, we'll make a match on that. So, when we ultimately introduce our employee package, I mean, we use the foundation of the company, and that is our core values and our mission. And so that really is where it starts, as a part of what they're going to have or experience as an employee of the company.
Thank you for sharing that. I know when I was the HR director, chief HR officer in different companies, one of the things that I've really felt like that was underutilized and is our EAP. And I think you get such a big bang for your buck as an employer to offer that type of benefit to employees, especially when you explain it to them that the services that they get from the EAP are either free or they come at a discount to them. And the majority of the things, again, are free. A certain number of counseling that they get to have for whatever they're experiencing, and their family members get that. And so those are like absolutely amazing. But the things that they miss are like a free advice with an attorney. So, people go, I don't know where to start with this problem I have. And really it's through their EAP. And if you go through what is available through your EAP, it will actually really give people a great sense of relief to know, oh, this is where I go for a solution. And it's not always just about having troubles or problems in their life. I remember someone said that they said, Tracy, you said to call them about any problem. And I was trying to cook a turkey for the first time, didn't know what to do. And they walked them through cooking a turkey. So I remember also when I was thinking about getting my kids in school enrolled, and I was doing research on dual language and language immersion programs. And I realized, oh, I could just call them. I did, and they sent me a list of all the ones that they had in my area and some enrollment information. They do things like, when you're selling a car, there is a bill of sale for you to actually print off and use, or creating wills. And I know that this is something people think that they'll do and drag their feet on how to do it. And I love their will kits because the will kits are set up for who you are. There's one for a single parent. There's one for married people who maybe have a blended family. They had all different kind of templates in there that were for different lifestyles. So I think that those are great ways to think about introducing your benefits to people throughout the year and how they could possibly use them. One of the other things that we were able to offer at Sleep Train was something that maybe you all can look at because it was free and people loved it. We offered a company called Tickets at Work, where people got discount tickets to events, like they could go to Vegas shows for discounts or go to Disneyland. And it was a free service that once you signed up for it, and all the employees got access to that. So that was one of the ones that we were able to offer and really enjoyed. So those are some of the things you can look at. And when I say EAP, it's Employee Assistance Plan. And again, most companies offer this. And sometimes it's through your life insurance or through another plan. They have these additional benefits. So if you don't have an EAP, Employee Assistance Plan, talk to your broker. And David, if you want to talk a little bit about that and that benefit, that would be great.
Yeah, so we definitely have the EAP tied, and how it's unique with us, and we do work with multiple vendors for life insurance and disability. But one of our vendors, Sun Life, has a large footprint in the United States for disability, and tied to all of their voluntary products. So if you wanted to offer voluntary life insurance or voluntary short or long-term disability, all of those products have the EAP benefit tied to it, and it's no additional cost. And it's just like Tracy had mentioned, all kinds of, employee assistance, which is the EA. But, from, counseling, like she said, answering questions. I want to find out how to cook a fried turkey. I'll get on that. But it could be simple will prep, trust preparation, like she said. All of those pieces are in there. And if you call into Decisely and are talking to one of our specialists, we can get you a flyer with additional information of what the EAP contains.
But it also is a very low cost item to offer to your employees. If it's
Yep.
not built into one of those already, you should definitely talk to your broker about providing that service. The employers usually pay for it. And I'm going to tell you, it's like nickels. It's not going to be really expensive to offer to your employees. And it's a big bang, especially if you promote it well. And I know I told my employees when they signed up or when they started with the company, put this number in your phone right now, because when you want it, you're going to wonder where it is. Put it in there right now. I really helped my managers to utilize that when they had employees who came to them with problems. Your employees will often want to come to you with all their problems, and you go, I got a solution for you. It's called EAP. It's not Tracy. This is where you can call and get some specialized information about the problems and challenges you're having with your child, getting them off to school, and maybe coming up with a way that will help the child prepare themselves a little more and less, anxiety. And I know one of my kids who she's told me, she doesn't mind me telling, but she has challenges with ADHD. And again, I forgot about using the EAP, but we got her a counselor who she called her coach, and she loved her coach, who gave her some strategies on how to actually manage her time and day better. And she loved it. We had a picture chart of all the things she had to do in the morning. And she looked at the pictures and okay, it had a toothbrush. I got to brush my teeth. I have to put on my clothes. So there was a little clothes icon. She got to check off her little chart every day. Cat dish to feed her cat. Check these off. And she actually felt really empowered by the tools that they gave her. And so, again, I think it's a great source of information for you all to use and to fall back on. So it doesn't have to be that you're in crisis. If you promote it well, that this is a normal thing that everybody goes through, life changes, it's a great tool. So we're going to move on a little bit more about maybe to the return on investment and communicating the value of benefits. David, this is like definitely in your wheelhouse. So when working with small businesses, how do you help them communicate the value of benefits to employees who may not immediately see their worth?
Yeah, so it goes back a little bit to what I had mentioned earlier with some of the plan designs that we were able to come up with. So a lot of times folks won't take care of themselves. They won't do those normal maintenance type procedures because there's a cost associated. So some of the plans and the carriers that we're partnered with eliminate a lot of those costs. So we're also able, as part of the HFA, to aggregate the entire membership. So when we go to our carriers and we're getting a healthcare quote, we're actually able to use the power of the masses as one larger group. We still do the underwriting for each individual group, so we understand what a risk profile is for a certain group. But we're able to be competitive on the overall price. So the cost of your monthly, premium, to pay, to participate in benefits is typically lower, and we're seeing anywhere between 5 and 10% from what the market is showing. So whatever your current renewal is, typically we're going to be able to beat it and then offer a richer plan. And the plan, like I said, has very limited copays. There's no deductible on a lot of these plans. There is a maximum out of pocket if you had, God forbid, something catastrophic come in, but that works just like a high deductible plan would work. So the value to the employees is lower cost on a monthly premium, and then typically a richer benefit than they're used to that they can able to take advantage of and use.
David,
I actually,
go ahead, Irene.
well, I was going to add to that, on the employer side, I think it's so important to make sure that you're communicating the value of the benefits because, I know it's a given, right? People just say, oh, I know I'm going to get a benefits package, but very few people understand the value of what the company is providing. So one of the things that we do, through our portal is provide them with a benefit statement. And it actually shows them the value of everything that they have benefits wise. And what that cost is and what the value is. And I've often heard employees say, I had no idea that that's what medical care coverage cost or dental coverage cost or vision cost. And I think I just wanted to go back to one other thing that you mentioned, Tracy, which was the EAP, which we use all the time when we have employees who reach out to us. But the other place that you get a lot of value, oftentimes that you might underutilize, is your 401k provider. We have them come in regularly to our locations and meet with employees and discuss, their savings and their retirement and what their plan is, and even provide a lot of financial advice. So we often find that's another really value area that a lot of times you don't utilize enough.
That is a great point that I know we've been focusing on the health and welfare, but again, Sarah and I, we both know, same with Irene, when we have people who start, they want to know your health and welfare benefits and your 401k. Do you offer a match? And how do you do those things? And, so all of those things come together for what will help to attract and retain a lot of your people. I know Irene just talked about having a portal that shows this, but you can do this with a low budget method. If you don't have a portal that actually does this, when you're putting out your benefits, put the total cost on there and what the employer is paying and what they're paying. Help them to see what you are contributing for their benefit and that it's not just here's what you're paying, because many of them think, oh, I'm paying the whole thing, and not realizing the contribution that you're making or the percentage of contribution that you're making. So just making sure that that information is visible. And this can be created through an Excel document that you could put together with what you're contributing for their 401k, what you're contributing to their health and welfare. And don't forget some things like, even the fact that you pay the taxes, the payroll taxes, you have things like workers' comp. There's a ton of things that you're paying. And if you can make that visible to them, that's really important for them to see. It's not just what they take home. You're also contributing to their welfare. Sarah, did you want to add to that?
Yes. I think most people on here are HFA members, and there's actually a great tool in the HR portal that's offered by HFA, and it's the total compensation statement. And all you have to do is plug in the numbers. There are some other great additional things that you can add in there to show your employees just maybe an estimate of like what you're paying for their training. Maybe you're bringing in a trainer to do some training and what that looks like if they are sent to any conferences, or I mean, that's not free, right? But they're getting it free. So even including all of that, and then also it's just a good way of showing them, how much time off they've earned throughout the year too. How many days have you gotten off and how many holidays, and just kind of that whole compensation package above their paycheck. So
Yes.
Thank you for bringing
it's
that
a
up.
great
because
tool on the HFA site.
So, David, I want to come back to you just for a moment. Are there any things beyond the traditional health and welfare or 401k plans that you've seen, or creative benefits that have been successfully implemented?
Yeah, I mean, to me, I think it's having a total benefits package. So I think that both Sarah and Irene have touched on it, that they're providing a comprehensive solution for their folks, not just offering medical by itself. And there's creative ways that you can do that. So, for some of the smaller groups, obviously major medical is the key, but then you're going to want to look at dental and vision and other ancillaries like, accident, critical illness, hospital indemnity. There are other plans that a group can offer, and they can structure that on a voluntary basis. So, with groups that may or may not be able to afford to do a whole lot more than just offer their medical contributions to their employees, they can allow their employees a choice of whether or not to participate in some of these additional ancillaries that can allow them to protect them and their families.
Great. Go ahead, Irene.
I'd like to add to that because that is a very good point, David. We offer short-term disability, long-term disability, life insurance. But one of the things that we found is that people want more, and sometimes it's more than we can provide to the whole population. So we've offered buy-up plans. So if you want more, it's available to you, and it might be a cost, and we try to keep that nominal cost. But I think that's one way to offer even more that people would want, that maybe you can't do yourself. So I agree with you on those.
And there's some other things like what Irene was saying that are available for people's lifestyle that will help them, that they're willing to pay for. I know pet insurance is a really popular one that's available, and people are willing to pay because they get a discount and can do it through payroll deduction. So that is one of those kind of plans that you can consider offering. And even though it's not a plan that you have to contribute to, people love the fact that they have those available to them. So I know that there was also some, if you're a certain size employers, you can sometimes get discounts for things like computers. I know one of the places I worked, we got discounts to Dell computers, or negotiated discounts for even shoes, that you could go to certain places and get shoes at a discount. So think about trying to offer discounts, negotiated discounts with people that maybe would be seen as a benefit, but doesn't necessarily cost you anything as well. So those are some of the things that you can consider. David, I don't want to skip over and see if there was any things that I struck an idea for you on, or if you want to mention that have been kind of creative or different.
No, like you said, yeah, it was good. The pet insurance is actually a big one. Folks are looking at, different things that they can, use to either, like I said, get a discount or provide coverage for their animals. My lovely significant other, she is a fur mommy, and they are her fur babies, and she has pet insurance on them. But yeah, I mean, but to Irene's point, just about anything out there, between, and Sarah was talking about, the discount tickets, there are so many ancillary products out there that can be offered on a voluntary basis. And if there's something that anyone has in particular that they're looking for, if we can't get it through Decisely, we can probably get it through Decisely. So let me
You
know if
have
there's a question.
dependent care. I think that's when we just started offering our employees this year, because we've seen we know everybody that's had a child knows the cost of daycare. And so just to kind of help our employees offset that and being able to pull money out before, tax-free money to pay for dependent care. So that was one we added to our plan this year.
So dependent care is similar to an FSA. It is a FSA, a flexible spending account, where you can take pre-tax dollars designated to the care of your dependents for you to work. So if you're paying daycare expenses there and you're paying maybe 10,000, I forget what the limit is this
I
year.
think it's 5.
Yeah, so 5,000 you're putting towards this. That's going to take down your taxable income to pay it through or to save it through your dependent care. And so it's a great program. And I would highly recommend, if you have a number of people that have childcare needs, that's something you can look into. Or if you have a large facility, to even find if there's one near their job that you can see if you can negotiate a discount for your employees. So again, there's a lot of different and creative strategies that you can use to look at offering some benefits to your employees. And it doesn't always have to cost you something, but just the affiliation with your organization makes a difference at times on those things. So if you also, so dependent care, David, if you don't mind, talk about who qualifies for dependent care.
So
like the children, obviously, and like if you have a disabled child who you're taking care of, who's beyond a minor, right? So
right. So
okay.
yeah. So those that would qualify for Social Security disability benefits and dependent minor children.
So those are the people that qualify for dependent care. So it doesn't necessarily have to be a minor, but it could be someone who does need care who's your dependent. So I would just say to look and see if you meet the criteria to do that, and that's offered, it's a great benefit to take on. So let's talk about, we talked a little bit about some of the ROI and communicating the value, but does anyone have any creative ways maybe they've communicated their benefits to people?
I can tell you one of the things that we've done is to have a benefits fair. So we do a monthly newsletter, and we include benefits information in that all the time. We do webinars, which we record, and they're part of our learning center. So we have JLA University, and we do webinars and seminars through there. And like I said, there's all kinds of information they can get. But one of the best things we ever did was a benefits fair where we had providers come. So all of our providers were there, our medical, dental, our vision, but we also had, the American Heart Association, the American Lung Association, and they were doing different tests. So we had also a program where they were getting kits, similar to what you see on TV, the ad for Cologuard. They were getting kits to be able to do that at home, send it in. We actually had 2 people that found out that they were younger than the first, so what is it now, 45 that you get your first colonoscopy. They were younger than that, but when they did the kit, they actually found they had a potential problem, ended up going to the doctor, having a colonoscopy, and found precancerous polyps, which, might have been a bigger problem. So doing kind of things like that, that was really valuable, and we invited families. So not just the employees, but their families. And so a lot of times, the guys in the warehouse, they're not going to come to that kind of thing, but their wives were interested. So they came as couples, right? So I think that was really one of the better things that we tried to do and was very well received.
And Irene, I'll tell you that my kids love benefit fairs. They think they're so cool. So I love that you invited the families, because they're like, we got toothbrushes, and they
Yes.
get all these little knickknacks from all the companies. They think every time I go to a conference and I bring back a knickknack that you must have gone to the coolest place ever. You have highlighters. And so all those little things that they do are really, they got them more interested in in their health. And so it was exciting for them to do their eye exam and test that
Yes.
they did there, and just all the little goodies that they get, and they got to learn a lot, and it actually generated a lot of good conversation in our house. But similar to Irene, I've had people that have gone to those, gotten their blood pressure tested or done something like their biometrics and realized their cholesterol was really high. And we actually had to send someone away in an ambulance. Their blood pressure was so high that they were in jeopardy of having a heart attack then. And could have possibly saved their life, because those are silent killers. And to be able to demonstrate to people that you care by offering this, and it doesn't even have to cost that much, but we did lots of cool things. We even brought in like a chiropractor. It didn't cost us anything. They wanted to talk about their services, and they got to give little mini assessments to them and talk about that. And we brought in massage therapists who got to talk about some things like, what kind of services they offer. They got 5-minute chair massages. So you can be creative and not just bring in the people that you offer benefits with, but also some other service providers in the local area. We had the same with a new dental office that moved in that said they wanted to come and offer discounts to our employees and be able to say that we're really close. So when you're going to work, it'll be easy for you to take off a small amount of time. And so you can do that as well if you can develop partnerships with those different kind of carriers. But I love the fact that you brought up the benefits fair, Irene. Sarah, did you want to add anything to this?
We've done just some engagement stuff between our locations. We have 6 locations, 7 if you include our administrative team, but we just, maybe some small little quizzes here and there just to see what the understanding is of some of our benefits. Our PTO has been one that we've had to focus on, just understanding how you earn it and what it's used for, and those types of things. So it's a good exercise, and just always communicating, and maybe even having like a benefit email every week, just with some good education. I like the newsletter idea. We have one that we try to do weekly, maybe bi-weekly, but just sticking in some benefit info in there just as the benefit of the week or whatever. So
We always do just in your newsletter. So what we added to our newsletter was like whatever the thing of the month is, maybe it's heart health that month. And so we added information that's part of our benefits about that. We always have a page on the EAP that's in there. So we always just include some of that information in that benefits in our regular newsletter every month.
Great.
And
Go ahead, David.
yeah,
Did you want to add something?
Yeah, with Decisely, so we're a little bit different than the actual employer groups like Irene and Sarah, but we do offer a concierge service, and that concierge is very broad, all the way from if a group is coming on board with benefits that we've been able to provide for them during their open enrollment. So if employees have questions about the plans that they're looking at, or if they want to do a comparison, or if they want to understand their benefits a little bit more, we have live folks that are available to talk to them during their open enrollment. And then after they've gone through their enrollment and their benefits are effective, they have that same concierge service that they can talk to as well. And it can be a chat on their phone or their tablet, or it can be they can call in and actually speak to a live human. But they're also assigned an account manager to each and individual group. So they have ongoing support through us to help answer those questions about their benefits and teach them how to use them if they have additional questions.
So one of the things that I used to love to do, well, I don't know if I said I love to do it, but we did it and people loved it, I should say, is life insurance often has travel benefits. Like if you get caught somewhere or injured somewhere, that people don't realize that they have. And so when we knew people were leaving the country, because if they're in the country, most people know how to navigate the insurance and hospitals. But I would put together a little packet and said, I heard you're going on a trip to Europe. Take this with you. And here's the life insurance. Here's the contact if you have a medical emergency. Here's what you do. So people love that. And I remember somebody said, hey, I'm going out of country again. Can you send me that packet again? Because they really appreciated seeing the value of their benefits that they maybe didn't even know that existed. So I love the fact that maybe we do a did you know kind of a thing, so people can say, oh yeah, there's something that I have available. But because most people won't think about it before they go on vacation, I knew I knew when a lot of people were leaving the country, because most people like to talk about the vacations they're going to have. So it was a great little thing to have, or to store it somewhere on your intranet where you can point it to people and say, take this with you so that you'll have all the contact information you need, or if you have to have an emergency evacuation from someplace. So cruises, and especially when they leave the country, that's great information for them to have. One of the other greatest things when I was at Sleep Train that we had too, that's not on here, is we had an ESOP, Employee Stock Ownership Plan. And that was incredible. We had great success with ours. We won all kind of national awards, regional awards for the ESOP that we had. And in less than 5 years is all we had it. And it saw astronomical returns. People's mindset and how they approached work changed because they knew that they were incrementally going to get pieces of the organization, or a value of the organization, when they were not able just to make money, but also save money, because in that your profit rise. That's a whole different topic to go into. And that's something for the owner to think about for their succession planning, to say, what am I planning to do with the organization? Sell it? Am I going to go public? Am I going to give it to the employees, or is it going to go to my family members? But an ESOP is one of those exit strategies for the ownership, and how they can consider giving back to employees without employees having to make the investment, and for employees' mindsets to change and to actually take on more of an owner interest. So I was fortunate to get to lead that. And our employees in less than 5 years averaged over $117,000 each when we exited, when we sold from Sleep Train to Mattress Firm. And so employees were thrilled. And I know we're coming up on the end of our time. I haven't seen any questions, but Caprice, I'm going to pass this back over to you. And
Great. Well, thank you, Tracy, for leading our conversation today, and our panel, for your expertise and insights, and for all of you that are in the audience attending. Don't forget to explore other resources and upcoming webinars for more strategies to drive your business forward at myhfa.org. Also, our next webinar will be on Thursday, March 27th. And we'll be talking about recruiting high-performing sales teams. We'll take a deep dive into proven methods to recruit, engage, and retain high-performing sales associates. I thank you for turning in and trusting HFA to support your business success, and hope all of you have a great day. Thank you so much for coming.
Thank you.
Thanks, everybody.
Thanks.